Medanta is not just a hospital, it's a concept. It's very unique, it's very different from other hospitals. It started off as a dream by Dr. Naresh Trehan. This hospital has been built around the skill of doctors and not a hospital building made and then doctors' skills are fitted in. Now, what does it mean in terms of actual operations? The focus changes to a patient-centric focus. If we have a patient of cancer coming to Medanta, he goes to the 10th floor, which has been designed by the cancer doctors. So he has the doctor's offices, the doctor's secretaries, doctor's OPD, inpatients, basic investigations, admission can be taken place and the patient can be discharged from there. Patient doesn't really have to move across very much. So that makes it in one way patient-centric. We have 1,250 beds in the hospital. We have 48 operation theatres. We have a 250 intensive care bed. Daily our footfalls for outpatients is about 2,500 to 3,000 patients. At any one time, we have about 1,100 patients admitted in the hospital. So it's a busy place.
There are only three things that can shut the hospital down. One is non-availability of the doctor, second is a fire, and third is an IT crash. The experience with IT in Medanta has been very promising. The healthcare life cycle partner for every patient is Medanta. When it comes to technology lifecycle partner, we need a very strong IT service provider who can actually partner with and understand that our common goals are in line with what the vision is.
HCL services have been a technology lifecycle partner for us. They have been involved in the conception stage, in the design stage, in the implementation stage and maintenance. I think that lifecycle partnership, right from the conception to implementation, has been a very smooth journey for us. They run our 24/7 operations, not just in Gurgaon, but also in Indore and Ranchi.
There's a huge amount of work which is done behind the scenes. For example, the patient records. That's one big area where IT has helped us. Investigations, whether in terms of results, whether in terms of scheduling patients, for different investigations, including the operation theatres. We have also in billing of patients, consents before a transplant and all. These are taken up and we use IT over there.
So what we are leveraging HCL services for designing my data center, my network architecture. In a hospital where we have so many heterogeneous devices lying in an area which is 2.2 million square feet, asset management is one of the most difficult challenge. In last 1 year, they took this job and 95% of the assets are known. I know where they are, who is using them at any given time. It can match with the inventory which is there with my finance department.
Medanta has been the forerunner to ensure that the best technologies, let it be CyberKnife, let it be Da Vinci robots, or let it be TRUS MRIs or etc. So HCL and being very instrumental in connecting these systems of medical equipment on a live mode, and also to ensure that the right treatment planning systems of the patients have been transmitted across the world. They connected the live robots which perform surgeries to a conference where the surgery from our Medanta hospital operation theatres were directly relayed across 7 countries.
In 4 years, relationship have become so mature that I leverage their expertise, not just which is deployed in Medanta, but also which are within the HCL services, or taken certain expert advice, be it on the newer future technologies or making my Lucknow data centers or how future network will look like.
It has improved the efficiency in the sense that the doctor and nurses now spend more time with the patient at the patient's bedside than sitting and just writing notes in a closed room. The throughput has increased, so we are able to see more patients. It's also helped in a big way in patient satisfaction.